Good morning, everybody. You're welcome to our third episode. As a reminder, we would like to mention that at the launching of my .md program, as we started for Health for All, we initiated by attempting to define health. Like I said earlier on, we embraced the definition of health by the WHO, which states that health is a state of physical, mental, and social well-being, and not merely an absence of disease. We went on to the second episode, focusing on the determinants of health. I will highlighted, as we stated in that episode, that there are many factors that determines our state of health, such as the socio-economic and the environmental factors, the personal behavior and characteristic factor, the genetics, the technologies, and so many other factors that work together that determines our state of health. And as we said, we are going into this topic today to describe the various levels of healthcare in the system. And after that, we go into the levels of prevention. So, welcome once again. As we go on, I would like to describe the levels of healthcare. These terminologies we need to pay attention to so that when we hear them from our doctors, our providers, we will have more information and will be more enlightened and understanding as to what they're talking about. So there are four major levels of healthcare. The first one is the primary level, which is the entry of any individual into the healthcare system. This is the level where you have your primary providers, such as your doctors, nurse practitioners, and the physician assistants. The common problems, health problems that we do encounter are confronted at this level of care, be it cold or minor injuries, cough, some infectious diseases, flu, and even some chronic problems that needs an attention. They have to come to the primary healthcare level first. And if there is need for referral to secondary care level, the primary doctor will be the coordinator of such referral. And most insurances, where they exist, they will expect you to see your primary care provider first before you can get specialist attention. So that's what we want to say at this stage about the primary care levels. The secondary care level is a specialized level. This is where the specialists are. These specialists, such as the cardiologists, the endocrinologists, the orthopedics, they are in these levels, and many other specialists. Cardiologists deals with the problems of the cardiovascular systems. The endocrinologist deals with problems that relates to problems relating to hormones, like the thyroid disease, the diabetes, and so on and so forth. While the surgeons deals with surgery, there are various kinds or types of surgeons, different specialties under surgery, orthopedics, neurosurgery, different kinds of surgeries, urology. So that's about surgery. You have all the specialists at the secondary levels. It's not the first level of entry for anybody. The people have to be referred to this level of care, mostly by the primary provider. That is their doctors, their nursing practitioners, nurse practitioners, and physician assistants. So this is where a more attention specifically is addressed concerning the health problems. The tertiary level of health sector is a more specialized level where you also have the specialists. These are found in hospitals when people need things like cardiac surgery, neurosurgery, and treatment of cancer. So this takes place in the hospitals mainly, and that is why they are tertiary cares. And a lot of education about health workers also takes place at this level. Doctors are trained, nurses are trained at this level. Various levels of specialists or providers are trained at the tertiary levels. The quaternary level is the highest level. That is not for everybody. This is where experimentation takes place. So it is the most highly specialized level. So, like I said, clinical trials takes place. Their experimentation takes place. Stem cells, researches, and things that takes place at the quaternary levels. So that's about the various levels. In summary, like I mentioned, there are various levels of healthcare. We start with the point of entry by anybody into the healthcare system, which is the primary care level, where you have your primary providers, and that is where they take care of your common problems. And move on to the secondary level, which are the specialists who gets their patients through referrals. And the tertiary levels are the hospitals that deals with the more specialized cases that requires like surgery, that requires dialysis, that requires a lot of more specialized treatment or care. So what I said, the quaternary level is not for everybody. That is a level where researches, advanced researches, and experimentations takes place. So that's all about the levels of care. So we move on now to levels of preventions of health problems. There are various levels of prevention. The first one, again, is the primary preventions, the secondary prevention, and the tertiary prevention. The primary prevention is what we do, what the government does or put in place that prevents the development of disease or injury. The secondary preventions are those things that are in place that reduce the impact of disease, while the tertiary prevention are those things in place that softens the impact of disease. Mind the terminology. One prevents the development of disease or injury. That is primary. The secondary soften or reduce the impact of disease on individuals, while the tertiary softens the impact of an ongoing illness or disease or injury on an individual. So we take them one after the other. The primary level of disease prevention involves, first of all, the legislations. That is the role of government. Legislations needs to be in place that will prevent and protect people from becoming sick. For instance, there needs to be ban or control of some substances that are injurious to health. Take for instance asbestos. There needs to be a legislation or control on the exposure to asbestos. Talk about lead. There's control on how much lead it is in paints, because paints containing high level of leads, when used in houses, they expose the growing child to some problems with their neurological system, such as mental retardation, cognition issues, and so forth. So there needs to be policy, legislative instruments in place that will regulate these items. The other things, such as prevention of accidents, legislation needs to be in place as to control the use of seat belts while we are driving. This it prevents diseases or the impact of accidents on individual. So those are various other things that government does to protect us or prevent the onset of diseases or injury. Then we move on, even at this level of prevention, which is primary, to health information, health education and information. What kind of diet do we eat? Our eating style. Are we eating just the high caloric diet that makes us to gain weight? Are we do we take anything that will provide us minerals, vitamins, and things like that? We need to know the kind of food to eat and how we cook our food, how much salt do we put in our food that will prevent the onset of hypertension or even diabetes. So our health, our eating habits needs to be enough information concerning this so that we will not develop illness at this level. Then about protection, there is need for protection of our health. We are healthy, but we don't want to move in the direction of disease. So we need to protect ourselves with immunization. Immunizations are processes, are facilities, are methods that are provided, that are available, that protect us to be able to resist any exposure to communicable diseases. When they come, we have system in us that can fight against the exposure to these organisms. For instance, the children have the childhood immunization program in place in most nations, where they get it as soon as they are born and at various stages of their life to get them ready for the reality of life. So they develop their immunities actively and passively as they grow up. Even for adults, people who are 50 and above, they are eligible to have in place things like pneumovax that will protect them against the overwhelming effect of pneumonia. That's a pneumonia shot. Then we also talk about shingles shot. These are conditions that when elderly people get exposed to, it could become very overwhelming. These immunizations will not completely remove exposure to these health conditions. However, it will protect them to the extent that when they do get exposed, these conditions will not be overwhelming on them. It will not take them out easily. They will be able to fight it and get out of it. So that is the purpose of immunization. It helps a lot. So when we see it, we need to go for it as soon as we get to the right age, go for those immunizations. It's not going to do us harm. We just need to believe that it's there to help us. So all the myth that surrounds immunization, with education, with information, this myth, all this will be demystified. And we will know that this is for our own good. So we need to take advantage of this and so that we can live a healthy life. So this is all about, we want to say at this level for the primary prevention of disease. I want to move on to the secondary prevention of disease. Secondary prevention of disease, like I said earlier on, is there to reduce the impact of disease on individuals or community. The disease has already set in, but we need to take advantage of this level so that the disease will not impact us to the level that will not be functional. No doubt, the disease is there. It needs to be diagnosed and treated timely so that we can move from that state of ill health to our original state of health, so that we can become functional again. So early detection of disease and prompt treatment is key to secondary level of prevention. That is very key. As soon as you get some symptoms that relates to a particular condition, you need to visit your care provider. And this needs to be detected, diagnosed as early as possible. And appropriate intervention is put in place in terms of medical treatment, if it requires surgery, surgical treatment, so that the process will be abated as soon as possible and you'll be well again to go back to your normal life and a good state of health. That is what it is about. Take, for instance, even some screening procedures are put in place to detect an early stage of some malignant condition. Cancer, that is why you see at the age of 45, people had to do colonoscopy to screen for early onset of colon cancer. Women has to do, from the age of 40, mammogram. At this stage, they are probably apparently healthy, but need to go for their mammogram so that we can discover if there's anything going on with the breast, so that early detection can lead to curative stage of that condition. It is often said that cancer is not curable, but with breast cancer, if it is discovered early, it could be abated at that stage before it becomes advanced stage, where it becomes more challenging to deal with. So that is the essence of screening. The screening is for you to discover what is going on, and you do it at intervals as it is recommended. So we should take advantage of those screening facilities, screening opportunities that are there, be it mammogram, be it colonoscopy. We should do it, and or if only to be reassured that okay, nothing is found. As for colonoscopy, no polyps, it's clean. If you are completely clean, that means you probably will not need another one until the next 10 years. But if they found something as simple as polyps, most facilities will get the polyps removed right away in the course of the colonoscopy. And when it is removed, it is subjected to tests, further tests like histology, pathology tests, and they see the kind of polyps you have. That kind will determine the frequency of your future colonoscopy. Sometimes 3 years, sometimes 5 years. That is if polyps were found. If it is completely clean, you will not be eligible for another one until the next 10 years. Meanwhile, there are some other things that will be done in between the 10 years. So, like the Cologuard, like the fecal occult test, those could be done within the 10 years. But for colonoscopy, for a clean colonoscopy, you'll be eligible for another one within the next 10 years. Mammogram, that is done yearly from the age of 40. However, people with family history, the family history dictates that you don't have to wait for 40 to begin the mammogram because of the strong family history. The same thing with colon cancer. People with strong family history of colon cancer, they will need colonoscopy much earlier. That will be determined by their primary care physician or providers. So that is about the secondary level of care. We'll move on to the tertiary level of care. This is a level of care that requires the specialist attention. You are going in there referred by either your primary or by your secondary level of care. When you get there, these are services provided by in the hospitals. People who need cardiac bypass, who need angiograms, who needs renal dialysis, who need kidney um, um, interventions such as dialysis or kidney transplants. These are things that takes place at the tertiary care. They are for the big boys. So they go there and they attend to you, and they look specifically into your system that is affected. If it is the heart, they look at it. The cardiologist look at it. If it's the kidney, the nephrologist look at it. If it is surgery, like neurosurgery, it could be a brain surgery. For instance, people who have aneurysm, they have to get quickly. The neurosurgeon has to get quickly and abate the problem. Otherwise, the jeopardy is serious. So people who have spinal issues, some of them has to be dealt with at the teaching at the level of the tertiary hospitals. This is also the level where our healthcare manpower are being trained, be it the doctors, be it the nurses, the physician assistants are trained at various levels at this tertiary level. This is a level that is very high up there. So our understanding of this various level will give us the opportunity to know and be more informed when our health workers, our providers are talking to us about things. We know what this level means. That's why we're bringing this to you, so we have more information and understanding. So I'm happy that we are here together again, in summary, to talk about the various levels of prevention of healthcare, prevention of diseases, such as the primary prevention, which talks about health information, which talks about immunization, which talks about government legislations, and go on to secondary prevention, which talks about reducing the impact of diseases, early diagnosis and prompt treatment. It talks about screening for chronic conditions like cancer, colonoscopy. It talks about mammogram to early detection of breast cancer. So we do that at the secondary level. The tertiary level, like I said, that is where it's a highly specialized level, mainly in the hospitals, where people require cardiac bypass, people require kidney transplant, people require neurosurgeries and things like that, be it brain, be it the spine surgeries. These things takes place at the tertiary levels. So with this understanding, I believe as we go along with other episodes in the future, we will have more understanding, and that will help us to improve our state of health. We are moving in the direction of positive health. So health for all is mandatory. We need to be healthy. We thank to God for the opportunity to be on here, and for you out there to stay on with us. Share this to as many people as possible. Give your likes to it and follow us as we move on. Thank you for listening. We'll see you in the next episode. Thank you once again.